Her name was Evelyn, 71 years old, retired librarian. One procedure, one day, in and out. 6 weeks later, the envelope arrived. 7 procedures billed to Medicare. She had received 1. The other 6, she never knew about them. Never consented, never received, never happened. Total billed in her name, $14,200. The hospital knew what they had submitted. They were counting on her never reading that envelope. If you are on Medicare and you have been to a hospital in the last 3 years, I need you to watch this until the end, because what I'm about to show you may be the most important thing you do with the next 20 minutes of your life. Before we go any further, I need to ask you something directly. Where are you watching from right now? And when was the last time you actually opened your Medicare summary notice and read every procedure listed on it? Not just the amount you owed, but every single line. Drop that in the comments. Tell me where you are. Tell me if you've ever seen a code or a charge on a medical bill that you couldn't explain. Because what you share will shape exactly what I cover next. And I believe there are people watching right now who are in Evelyn's exact situation and don't know it yet. Stay with me, because what comes next is the part your hospital's billing department has been hoping you would never find. Now, to understand what happened to Evelyn and why it has been happening to Medicare patients across this country for decades, I need to take you inside the billing process, not the medical side, the business side, the side that runs in a back office while you are still recovering in the procedure room. Here is how Medicare billing actually works, and here is why almost nobody over 65 has ever been told this clearly. When you go to a hospital for a surgery, an outpatient procedure, a specialist visit, anything, the clinical staff treats you, and then separately, a billing department codes what happened. They translate every procedure, every consultation, every test into a set of numbers called CPT codes, current procedural terminology codes. Those codes get submitted electronically to Medicare, usually within days of your discharge. Medicare's automated system receives the codes, checks that they follow Medicare's billing rules, and issues payment. Automatically, quickly, before you have seen anything. 6 weeks later, sometimes 8, sometimes 10, you receive a document in the mail. It's called a Medicare summary notice. It comes in a blue and white envelope. Most people over 65 open it, check that their out-of-pocket amount looks roughly right, and put it in a drawer. Or they don't open it at all, because they've been told that Medicare handles the rest, and they trust that what was submitted was what actually happened. That trust is exactly what the billing system is built on. Think of it this way. Imagine you hired a contractor to repair your roof. You were at work all day. When you came home, the contractor handed you an invoice for 12 separate services. You weren't there to watch. You trust the contractor. You pay the invoice. You never go up on the roof to check whether all 12 repairs were actually made. That is exactly the position every Medicare patient is in, every single time they receive care at a hospital. Except the invoice goes directly to the federal government, and you only see a summary of it weeks later. The people most affected by this are not young patients with sharp eyes on their financial records. They are people over 65, over 70, people who have been to the same hospital system for years, who trust their doctors, who assume that if something was on the bill, it must have been done, and who have never been taught that the Medicare summary notice is not a courtesy document. It is a legal record, and they are the last line of verification before charges become permanent. You have probably had this experience, even if you didn't name it at the time. You opened a Medicare summary notice and saw more line items than you expected. You saw a provider's name you didn't recognize, a specialist, a consultant, someone whose name appeared on a bill from a visit where you only remember seeing 1 or 2 people. You saw a procedure listed that sounded vaguely familiar, but that you couldn't pinpoint in your memory of that day. And you told yourself, I must be misremembering. They must know what they're doing. It's probably fine. That is not misremembering. That is a signal, and that signal has a name. It is called upcoding when the hospital bills for a more expensive version of a procedure than was actually performed, charging for a complex surgical intervention when a simple one was done. It is called unbundling when procedures that should be billed as a single combined code are split into multiple separate codes, each one triggering its own payment. And it is called phantom billing when a procedure, consultation, or test that never occurred at all is submitted as if it did. All three of these billing practices occur in American hospitals. All three are documented, and all three rely on patients never looking closely at the document that arrives 6 weeks after they've gone home and stopped thinking about the visit. And that's not all, because here is where the problem becomes something larger than a billing error. The system that processes these claims is not designed to catch them. Medicare handles more than 1.2 billion claims every single year. Those claims are processed largely by automated systems that check whether the codes follow Medicare's billing rules, not whether the procedures actually happen to a real person's body. The speed of the system, which is designed to pay providers quickly and keep healthcare moving, is the same feature that allows phantom charges to move through undetected. By the time your summary notice arrives in your mailbox, the money has already been paid. The hospital has already received it. And the only person in the entire chain who can confirm whether those procedures actually took place, the only person with first-hand knowledge, is you. Because the hospital billing department knows this. They know that Medicare patients, on average, do not audit their summary notices. They know that the codes on those documents are not written in plain language. They are written in a specialized billing language that no patient is expected to understand. And they know that even if a patient calls to ask about a charge, a verbal explanation from a billing representative creates no paper trail, triggers no federal review, and changes nothing. The system continues. Evelyn's case is not unusual. What was unusual was that her daughter happened to be a nurse, and nurses read billing documents differently than most people. Her daughter looked at the summary notice and knew, without needing to investigate, that 3 of the codes listed referred to procedures Evelyn was not awake for, present for, or informed about, and she didn't let it go. Most patients don't have a nurse at the kitchen table. You need the next best thing. And that's what this video is. Now here is the data behind what I'm telling you. The HHS Office of Inspector General, the federal watchdog agency that oversees Medicare, publishes an annual report on improper Medicare payments. In the most recent reporting year, the OIG estimated improper Medicare payments, including overbilling, upcoding, and phantom procedures, at $31.7 billion. That is not a fringe problem. That is a systemic feature of a billing structure that moves faster than its own oversight can follow. And in targeted audits that the OIG conducted on specific hospital claims, audits where investigators actually checked the medical records against the billing submissions, they found errors in approximately 1 in 4 claims reviewed. Let that land for a moment. If you have had 4 hospital visits or outpatient procedures on Medicare, the documented audit data suggests that at least one of those visits may have generated a billing submission with an error you were never told about. That error may have been corrected internally. It may still be sitting in your Medicare record. You have no way of knowing unless you look, and the looking is simpler than anyone has ever told you. Right now, I want you to think about your last hospital visit or outpatient procedure. Did you receive a Medicare summary notice afterward? Did you read every procedure listed, every code, every provider name, every date of service? Leave that in the comments. Tell me how many procedures were listed and whether they match what you actually remember happening that day. Because if you're not sure, what I'm about to walk you through in the next few minutes was built specifically for that uncertainty. Do not leave now. This is the part that matters most. Here is what almost nobody knows, and it is the reason this video exists. Every Medicare beneficiary in the United States has the legal right, a federal right, to request a complete itemized bill from any hospital or provider, and a complete copy of every claim submitted to Medicare in their name at no charge. Not a summary, an itemized record. Every procedure, every code, every date, every provider name. Most people over 65 have never been told this right exists. Hospitals do not post it in their waiting rooms. The Medicare handbook mentions it in general terms. No one sits down with you after a procedure and says, "Here is what we submitted in your name. Here is how to verify it. Here is what to do if something is wrong." You were never given that conversation. It was never offered. But here is the counterintuitive truth that changes everything. You do not need a lawyer, an accountant, or a medical degree to identify a phantom charge. You need two documents, a pen, and the willingness to compare what the hospital says happened to what you remember happening to your own body. That comparison, that simple kitchen table comparison, is what Evelyn's daughter did. It is what triggered everything that followed. And it is something every person on Medicare can do this week. The first thing you do is call the hospital's billing department and request a complete, itemized statement of all services billed on your behalf. Use this exact phrasing. "I am requesting a complete, itemized statement of all services billed on my behalf, including all CPT codes and the date of service for each charge." They are legally required to provide it, in writing, free of charge. If they offer to mail it, confirm the address. If they say it will take 2 to 4 weeks, that is within normal range. Make a note of the date you called, the name of the person you spoke with, and the date they said it would arrive. That note becomes your first document. While you wait for the itemized bill, go to mymedicare.gov. If you do not have an account, create one. It takes less than 10 minutes. Once you are logged in, every claim submitted to Medicare in your name for the past 3 years is listed in your account. Dates, provider names, procedure codes, amounts billed, amounts paid. Print or download the claims that correspond to the hospital visit you are questioning. This is your second document. When the itemized bill arrives, put it and the Medicare printout on the same table. Go line by line. For every procedure listed, ask yourself 3 questions and only 3 questions. Did this happen to me? Do I recognize this provider's name? Does this date match when I was actually at the hospital? You are not trying to decode medical terminology. You are looking for providers you have never heard of, dates that don't line up, and procedures that you have no memory of. Mark every line where the answer to any of those 3 questions is no or I'm not sure. If you have marked anything, even one line, the next step is to file a report with the HHS Office of Inspector General. Go to oig.hhs.gov. There is a fraud reporting hotline, 1-800-HHS-TIPS, and an online complaint portal. This is a federal reporting mechanism. Submissions are reviewed by trained investigators. When a hospital receives an OIG inquiry tied to a specific patient claim, that is a different conversation than when a patient calls the billing line to ask a question. The response is different, the urgency is different, the paper trail is federal. At the same time, and this is what people who have successfully recovered corrections did, file simultaneously with your state's Senior Medicare Patrol. Every state in the country has one. This is a federally funded program staffed by trained volunteers whose entire function is to help Medicare beneficiaries review their claims and report suspected fraud. They will sit with you, in person or by phone, review your documents, help you understand what you're looking at, and guide you through the complaint process at no cost. You can find your state's Senior Medicare Patrol at smpresource.org. That website, That phone call and that volunteer may be the most valuable resource you have never been told existed. The most common mistake people make when they start this process is calling the hospital's general billing line and accepting a verbal explanation of the codes. The representative on that call is not an investigator. They are a customer service employee whose job is to resolve the call, not to audit the claim. A verbal explanation creates no record and triggers no review. If the billing department tells you verbally that a code was correct, that explanation means nothing from a regulatory standpoint. Everything, the itemized bill request, any dispute you file, any response you receive, must be in writing. The second mistake is accepting a partial correction and stopping there. Hospitals, when they know they are being scrutinized, will sometimes offer to remove one or two charges while leaving others intact. Do not accept a partial resolution as a complete one. Your written dispute should specify every charge you are questioning. Your OIG complaint should list every code you could not verify. You are not being aggressive. You are exercising a federal right. There is a significant difference between those two things. Most people who request their itemized bill and sit down with their Medicare summary complete that comparison in one afternoon. Filing an OIG complaint takes less than 20 minutes. Senior Medicare Patrol volunteers typically respond within a week. If a formal audit is triggered, the hospital has a defined window to respond. Resolution, including billing corrections and formal notification to the patient, typically occurs within 90 to 120 days. That is not a long time, not when you consider that the alternative is having phantom procedures sit permanently in your Medicare record attached to your identity without your knowledge. The Medicare summary notice sitting in your drawer is not junk mail. It is a federal record of every procedure billed in your name. Treat it like one. But before we close, I need to tell you what happened to Evelyn after she and her daughter decided not to let it go. Evelyn's daughter called the hospital's billing department the same day she spotted the discrepancy. The billing representative was polite. She said she would flag it for review. She said someone would follow up. 30 days passed. No follow-up, no correction, no written response of any kind. So Evelyn filed online with the HHS OIG. Her daughter helped her fill out the form. It took 18 minutes. The same week, they contacted Arizona's Senior Medicare Patrol. A volunteer called them back within 4 days, reviewed the documents by phone, and confirmed that 4 of the 6 disputed codes had no corresponding procedure that a patient in Evelyn's situation would typically receive during a routine outpatient knee procedure. 6 weeks after the OIG complaint was filed, Evelyn received a written notification that a formal audit of her claims had been initiated. 8 weeks after that, 14 weeks total from the day the complaint was filed, she received a second notification. The audit had confirmed that 4 of the 6 phantom procedures lacked supporting documentation in her medical record. The hospital had corrected the billing. The false charges had been removed from her Medicare history, and the hospital had been required to refund $9,400 to the federal government. 14 weeks, 2 documents, 1 online complaint form. Evelyn told me something that stayed with me. She said, "I almost put that envelope in the drawer like I always did. My daughter almost didn't say anything. She almost decided it wasn't her place to bring it up. And I think about how many people don't have someone sitting across the table to notice. You know what the envelope contains. You know how to read it. You know the 3 questions to ask for every line. You know the federal process that creates a paper trail and triggers a mandatory response. And you know that what happened to Evelyn is not rare. It is documented. It is widespread, and it is happening to Medicare patients who are doing exactly what they were told to do, trusting the system to get it right. Is there someone in your life, a spouse, a sibling, a parent, who has been to a hospital in the last 2 years and has never once opened that blue and white envelope with real attention? Picture their face right now. because if that person came to mind, send them this video before you do anything else. Not tomorrow, right now. You may not be able to undo what has already been billed in their name, but you can make sure it doesn't keep happening, and that it doesn't keep sitting unquestioned in a federal record attached to the only Medicare number they will ever have. In my next video, I am going to show you the 5 Medicare summary notice codes that appear in phantom billing cases more than any others, and the one provider category that shows up in these cases at a rate that will stop you cold. It is not who you think. Turn on the bell right now. I cannot guarantee the algorithm will show you that video if you are not subscribed when it arrives. And given what you just learned, I don't want you to miss it. Subscribe now. The next video may arrive on the exact day you need it most. 10 years from now, you will be one of 2 people. You will be the one who heard this, opened the envelope, asked the 3 questions, and made sure the record attached to their name was accurate. Or you will be the one who heard it and put the envelope back in the drawer. The difference between those 2 people is not luck. It is not circumstance. It is not a matter of having a nurse for a daughter. It is 30 minutes, 2 documents, and the decision to treat your Medicare record the way it deserves to be treated, as a legal document that belongs to you. That decision starts today, and it starts with the envelope.